Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications and one of the MCs here at Gold Learning, where we're back here again talking about our up and coming event, our Tongue Tie Symposium. And of course, this is the one that I know that you all wait for year after year to come and join us. And so you can head over to the website right now to goldtonguetie.com, where you can actually register for this event right now and join myself and my guest speaker here today. So welcome to Natasha Duffin, or Tash.
Hiya.
Welcome. It's so good to have you here today, Tash.
Thank you for having me. I'm glad to be here.
Yeah, absolutely. And we're going to be talking all about what you're going to be sharing about in just a moment. But first of all, please just share a little bit about yourself. Tell folks where you are in the world.
I am in Perth, Western Australia, as you may have picked from my accent. So across the other side of the world from you guys.
Yeah, that's amazing. And so tell me, what's your practice look like there?
Yeah, so I'm an occupational therapist by trade, and I specialize in pediatric sleep and orofacial myofunctional therapy. So I do a blend of in-person in a clinic, home, and online.
Oh, wow.
So I focus on a lot of things, really. So the
Yeah.
oral function and feeding and things like that. Like how oral function promotes sleep, really.
Sure.
And so I work with little babies who don't sleep
Oh,
well, all the way through to 12-year-olds who are
right.
having tongue tie releases or palate expanders. So I have a really wide range.
Yeah.
My sleep practice is very focused on quality of sleep. So,
Yeah.
and I'll cover this in my presentation, but focusing on sleep quality and how quantity and quality are very different, and how when children or babies don't sleep well,
Mhm.
we want to look at why they're not sleeping well, not just
Sure.
whacking on band-aids of trying to teach them to self-settle and, going hard on routines. Like, those things
Yeah.
might help a little bit for some children, but when sleep is really difficult, um, I want to look at why. And things like oral function, nose breathing, tongue ties, which again, all covered in my presentation, are a
Yeah.
big part of that. So my big part of my role is identifying those barriers to good quality sleep and helping families navigate that process and where to go and who to see and all those bits and bobs.
That's amazing. Well, I think by now, I just in your intro, I think you've just captured the audience because everyone's like, "Bang, wait a second, she's talking about sleep." Or, there's a lot of controversy in there. And now with all the body work that you do as well, in terms of just, and everyone's talking about this different types of, breathing, nasal breathing and, what it looks like and, how the posture is and all those types of things. So that's incredible because I think that it's an area that we haven't tapped into enough, obviously, because, well, you'd probably agree with that, I'm sure.
Yeah,
And we don't, we don't get the referrals out to you enough. So let it be said here first, keep referring, refer,
yeah.
because we know that your practice is doing incredible things, and you're looking at another different angle. And I think that, it's not always about just referring for the sake of it, but there's a lot of little ones that, like you said, it starts off as one thing and then you start to investigate and you see that there's actually a whole slew of other things going on. So it's not just about setting schedules, getting people to sleep and all those types of things. It's actually tracing back and looking at what the actual cause is to start.
Yeah, absolutely. Yeah,
Yeah.
sleep is a biological process, and if it's a real struggle for a child,
Yeah.
we need to dig deep and figure out why it's such a struggle for them. And those kids that don't respond to different awake times or routines and that kind of stuff,
Yeah.
there's generally a reason why.
Absolutely. Okay, so there's a whole bunch of people jumping up and down right now, and they're like, "Okay, I, I'm going to call you." Well, you can come and listen to
Yeah.
Tash Duffin. She's going to be here with us at our tongue tie symposium. We're very honored to have you, of course, promoting optimal oral rest posture and nasal breathing after tongue tie release. So another big topic that you're going to be speaking to. Now, you're going to be speaking live. So there's a couple of parameters I want to talk about briefly here. You're going to be speaking live at the event, which is is really exciting. And that means that people will be able to come in and engage with you, and we're going to have a live Q&A and all those types of things as well, which is really valuable to the audience because it means that they can really get a deeper dive and sort of, get an opportunity to sit down with you as well. So that's the first thing. But let's go back a little bit more because I want to connect the dots with you a little bit and learn a little bit, the hows and whys and what inspired you to focus and sort of make the connection between tongue tie release and oral rest posture and breathing. Like, how did that all come together? Because I feel like, there still isn't enough conversation about it. But how did this come about for you?
For me, like so many people in this field, it was my own children. And so I have 3 children. My first child, I thought was a bad sleeper, but really she was just a baby. It was the books that I was reading that were the bad thing. Then come along my next one and undiagnosed tongue tie. My next one, undiagnosed tongue tie. And what I found is there was a lack of people that could diagnose things properly for me. There was weight loss, there was aerophagia, there was, eczema, all these things that I just kept being told, they'll be fine, they'll grow out of it. Even though I was asking specifically, is there a tongue tie? Is there a tongue tie?
Sure. Yeah.
Then things spiraled basically. And, with the reflux, we get enlarged adenoids and airway issues and all that kind of stuff. And I just was like, where are all these people to do this? And why aren't people educating families on this and trying to help people that are like, your kid's vomiting nonstop. Like if an adult's vomiting nonstop, we'd be looking into it. And they grow out of it, but it can't be nice for them.
No,
even if they're a happy chucker as mine were. I had already had an interest in sleep, and I kind of was like reading these things. It's like, why should they have this 2-hour nap? Why? With that health science background, I really kind of reverse engineered and was like, but where is the science there? And then I, understood all the sleep science. And then when 2 of mine had issues, then going, okay, this is why I'm seeing this behavior. This is why I'm seeing this. And then really just, fell into it, dived in and just really wanted to investigate, like selfishly as well. And I just was like, I need to know everything. I need to be able to help my babies and then share this knowledge and these skills with other families and, help validate them and give them some answers that perhaps they're not getting anywhere else.
Amazing. So there's nothing like the best thing that I love is stubborn mothers, who are not willing to give up, and they will walk through anything in order to find solutions. And it sounds like, that's where you landed with this, which is incredible because now you've become the source and the resource for so many families and clinicians. I mean, that's the reality. We're still learning and I'm still learning, alongside you. This is not my area of expertise. So I need to really understand from you, sort of what some of these things are. So let's just cover it just briefly, if you don't mind, just for a minute here. We'll do a bit of rapid fire, on a few of these questions here. So if I'm brand new and I'm just coming into this, tell me just briefly what optimal oral rest posture means and why nasal breathing is so important.
Yeah, so optimal oral rest posture means tongue to palate, lip seal, teeth slightly apart, and nose breathing. So I think it's about 80% or maybe even more of our craniofacial development is done by 6 years old.
Right.
So what we do, how we use all those structures, how we rest, how we breathe, how we eat, how we sleep, shapes our growth as we grow. So that's why it's so important. I've forgotten the second part of the question.
Oh, no, you're good. The second part was just really, why nasal breathing is so important. Yeah.
So nasal breathing is really important. It's the most efficient way to breathe. the nose is the filter. It warms air. It filters out, bugs and that kind of stuff, allergens. So it prepares the air for the lungs. So the lungs are going to be less reactive. It also is where the body produces the most of something called nitric oxide. And that promotes optimal gas exchange. It means that everything works kind of in unison in the body. And it signals to our nervous system, you're safe. Oxygenation is good.
Wow.
So that impacts our sleep really significantly, like lets our bodies get into deep restorative sleep.
Wow.
You've probably seen stuff around like on social media, like nose strips and things like that. Yeah.
Yep.
So that's essentially what they're trying to do. They're trying, and people saying, oh my gosh, my sleep's so much better when I've got these on, or I tape my lips, because you're nose breathing. Please don't tape your lips if you can't breathe through your nose. That's a whole other
thing. Okay. I was just gonna ask.
But if you've got narrow nasal passages and you're wider than by opening up with some tapes, that's why people are feeling better, because they can breathe through their nose like they're meant to be able to breathe through their nose. So if we optimize craniofacial growth from infancy by getting that tongue to the palate, our lip seal and nose breathing, then ideally we don't need any tapes. We have our nice wide nasal passages. We rest with lip seal because that's what we know. And that is optimal function all the time.
Oh my gosh. So now you've grabbed everybody's attention. Yes, for sure. Because yes, this is what's being talked about, but we're not really quite understanding it. How does this apply to children? I know you're going to be answering a lot of these questions as well. And before I let you go, just give me a snippet on what you're seeing in the research long term, what the benefit might be to this, like the why. Why would we, do all of this? Tell me.
Well, again, it's that. And I cover this a lot in my talk, like it's this spiral. We can snowball, and we might have poor oral rest posture as an infant, which then means that impacts our craniofacial growth. We have a longer face. We need more dental work. We become a habitual mouth breather. Down the track, we get obstructive sleep apnea. Which everybody knows is not good news. If we can capture these things early on, and if it's, like it's often multifactorial, but if it's about, getting that tongue to the palate and teaching our babies to chew, and then instead of going down this way, we're going down this way, where we have beautiful wide nostrils. We have a mouth that can fit all our teeth. We sleep healthily. We breathe healthily for the rest of our lives, and don't end up in this obstructive sleep apnea and all the other bits and bobs that can come with that. So it's really about it's about overall health, and it's a very common thing to be mouth breathing and all those kind of things, as evidenced by all the things on social media. Like, we shouldn't need those things. We should do that naturally. But because of, again, another whole thing, but, industrialization, and we no longer eat, like that's develop. We have foods in packets and stuff like that. So for a long time, our jaws have been shrinking. And that's the result of suboptimal oral rest posture and growth, and forces that promote that craniofacial development and growth. For it's health. It also means less dental bills down the track. But also it's about breathing and health and sleep and breath is life, basically.
Yeah, absolutely. And not ending up in those chronic situations, like you said. Yeah, absolutely fascinating. And I think that, this is the moment in time that we need to be paying attention to this, because we have been seeing this definitely in the field of, breastfeeding, lactation, feeding generally, like you said, not just beyond the breast and so forth and so on. And so yes, you have my attention, my friend. So I'm very excited. And so thank you so much. Thank you for just giving us a snippet on sort of a little bit of your background and sort of, where this topic comes in and what we can do with it. I'm really excited to learn more from you. So thank you so much, Tash, for being here today. Again, your presentation, you're going to be talking about promoting optimal oral rest posture and nasal breathing after tongue tie release, which is something that we're going to be able to, obviously take into our families, which is incredible and help support them. Well, thank you again for joining me here today. Thank you to everyone listening in today too. I hope that you've enjoyed being with us, and we'll look forward, of course, to seeing you online. You can join us over at goldtonguetie.com right now to register for this event and catch up on all the details. We'll look forward to seeing you live, of course, and have a wonderful rest of your day, everyone, wherever you are. Bye-bye for now, everyone.